It is really my pleasure to have this opportunity, and thank you, Director Cho and the Deputy Director Cho to invite me to let me really deep thinking about our workforce, following very important lecture from expertise from global, from nation, etc. Because the health security only be available and highly depends on human being. Although we're talking about AI, but the expert told me that what is intelligent, we really need to think about. Regarding the public health, it's a cumulate of individual person. When we're talking about the data, we need to realize how the data generate, how the data analyze, and how to use the data. All this is kind of public health, and I'm an ID physician. I'm from the front line. Because of SARS, changed my whole life. I become more or less like a public health personnel. Why? As people always say, we infection control personnel. It's like a hospital pay our salary, but we do something for the public health, for the government. And this is a very successful model in Taiwan. We have the dedicated person, expertise, but closely work together with Taiwan CDC, from central government to local government to the front line in a hospital setting. We need to have expertise and a good relationship with your superintendent, with your colleague, with everyone in the hospital to work together. So the health security framework not only detect and the response, nowadays more and more emphasize is preparedness. After SARS, Taiwan government take a lot of effort to review and to refine. So I try to emphasize, because the international emphasize we need to consider the recovery phase. But in Taiwan, in 2003, we take time to review and to refine, to strengthen our system for the whole country, from the public health as well as the healthcare system together. The health security depends on the existence of the strong and the resilient system. I try to emphasize the existence because it is not a theory, it's not a wish. It should be on board when the disaster occurs or the beginning of the outbreak or the epidemic. As Dr. Luo, our Director General, emphasized the One Health. So we need to more collaboration, not just the human sector, but as well as others. I put into compare the public health and the hospital infection prevention control. I will pay more attention in hospital sector as where I work for more than 30 years. And very important as the public health is accumulation of the individual. And all the policy is for human being. And all the decision is based on the personal, why we decide to be so. It usually depends on few individuals. But in the past more than 30 years, I meet many good guys. They are so silent, but they support all the system to be existing when the crisis occur, and they're willing to do something for the public good, not just for individual. So this I really appreciate. But in the front line, we have multifunction. We need to serve as the first health security in healthcare facility, because every epidemic, usually the key issue is to prevent, amplify in the hospital setting, and prepare the healthcare capacity to protect our people. Might be you'll get infected, but if you have strong system to handle your healthcare, even our healthcare worker, they are be confident to involve, to take care those with a known etiology but critical ill. They are so confident just because we strongly support to protect them. However, we need to prepare all the skill and the knowledge. It cannot be now. We need to prepare ourselves. So during every crisis, I can take the advantage to have the very excellent professional nearby. So I ask them domain knowledge and put into as a policy to healthcare as well as for the infection control. And why I say we are paid by the hospital but do something for the government, because the notification. We, in the front line, through education, we early identify the people with potential outbreak, causing outbreak and others. And through the notification process and the case management, we can, without a gap, we can together to handle the health of the in this case, as well as the contact tracing to protect others. So although the key element of IPC is surveillance, but very important, we integrate surveillance, the data, and the action timely. So we cross-relate, integrate with the public health. This is however, the world become more and more complicated. We have a lot of involving threat. The microorganism cross-kingdom to infect human from animal, from plants and other environment. And they cross the political or geographic boundary. So we have more and more imported case, infectious disease, and more emergent or re-emergent, including antimicrobial resistance. So in the community and the global vision, we have a lot of threat. However, in the hospital setting, nowadays, we have the advance in healthcare, but it becomes very complicated how to protect our patient when they group together in the hospital. So we have to monitor the so-called healthcare associated infection. We need to dealing with the obtaining infection for those more vulnerable. However, because the whole environment, the host, the environment intervention, and the emergent pathogen, we are facing a moving target, and all the presentation is very widely. So it is very difficult. When every crisis, we need to dealing with 4S, but I need to emphasize, during our preparedness plan, we never talking about the leadership. In addition, we never prepare for the surgical capacity for those infection control personnel, a tiny minor detail. However, all the issues have demonstrated in recent years in Taiwan or in other countries. Especially in Taiwan, nowadays we facing a shortage of qualified public health and infection control personnel. It has become a growing concern. Our IPC is, we always try to identify the risk and try to provide a signal and invite stakeholders together to solve the issue. And this staffing shortage was exacerbated by the COVID-19 pandemic and the competing priority and other factors. Facing a super old society and low birth rate in Taiwan and other countries, we're facing a triple pressure. So we had the overall shrinking healthcare personnel pool. So several policy key person, they say they are really sorry they didn't recognize our need. They didn't recognize the shortage of the IPC personnel because we are minor, tiny detail. However, the main core IPC functions such as surveillance, auditing, environment control, etc., is the need expertise and very labor intensive. However, we're facing many challenges and the demands is more. However, there also a gap between public expectation and the public understanding of IPC, which affect resource allocation, workforce support, and the long-term system investment. I will show a data we present last year in our annual meeting of Infection Control Society of Taiwan. This data is presented by Infectious Disease Society, Secretary General and the President of Infectious Disease Society of Taiwan to emphasize the demand and the new entrant and the anticipate retirement. They create a more and more staffing shortage. Does this any impact? It's just your own problem. However, the shortage of manpower creates some negative impact. As IPC covers 4 major domains, it's not only patient safety, care quality, it also concerns occupation safety and the society sustainability. According to the publication, this is from United States, the survey found that the hospitals that are understaffed for IPC have higher rate of select healthcare associated infection. And the one-size-fits-all policy is no longer sufficient. And this is our data from Infection Control Society of Taiwan. We analyze and present in the summit focus on workforce shortage. And according to national hospital surveillance for infection control, we facing the staffing shortage, and our anonymous survey emphasize the situation even worse. So why? Because the IPC, we already demonstrate our strengths and our achievement. So our colleague, our government, our hospital depends on IPC and realize the importance of IPC. So we have multiple tasks, and we play multiple functions or roles. So however, the level of role of this function may vary based on the task. Either it play accountability, responsible, or consult or partial share. They will create the different challenge. So we have now more and more demand. However, we shortage of supply, and all become more complicated due to the crisis and environment. So we need to deep thinking for the long run. We need to transform how to generate and sustain this workflow. We need to think about from not just more stuff. We need to think about how to redesign for a smart system to overcome the challenge from different strategies. I would like not to go into detail, and you need to discuss and deep thinking for many from different stakeholders. So this is my closing thought. We need to move from the shortage to recognize the shortage and their impact, to smartly redesign to strengthen our system by different strategy. And this is a collective responsibility. We need to together and think about that. Thank you for your attention.